Colloidal oatmeal cream is used as a moisturizer to treat or prevent dry, rough, scaly, itchy skin and minor skin irritations such as diaper rash and skin burns from radiation therapy. It softens and moisturizes the skin, reduces itching and flaking, and protects the skin against irritation. Dry skin is caused by a loss of water in the upper layer of the skin, and colloidal oatmeal cream works by forming an oily layer on the top of the skin that traps water in the skin. It also contains ingredients that soften the top layer of skin cells, helping the dead skin cells fall off, keeping the skin hydrated, and leaving it feeling smoother and softer. It is best to apply colloidal oatmeal cream daily, as needed, and it can be used at any time of the day. Make sure to use this product as directed. Some products may need to be primed before use, so be sure to follow all the directions on the product package. If you have any questions, it's best to ask your doctor or pharmacist for guidance. For some products, you may need to shake the bottle well before using. Always check the label to see if shaking is necessary. Then, simply apply the cream to the affected areas of your skin as needed or as directed on the label or by your doctor. The frequency of application will depend on the product and your skin condition. For example, if you're treating dry hands, you may need to use the cream every time you wash your hands, applying it throughout the day. If you're using this product to treat diaper rash, make sure to clean the diaper area well before applying the cream, and allow the area to dry before use. And if you're using this product to help treat radiation skin burns, it's important to check with radiation personnel to see if your brand can be applied before radiation therapy. Be sure to follow all the directions on the label for proper use, and only apply the cream to the skin. Avoid sensitive areas such as your eyes, inside your mouth/nose, and the vaginal/groin area, unless the label or your doctor tells you otherwise. Always check the label for directions about any areas or types of skin where you should not apply the product, and consult your doctor or pharmacist for more details. Using this cream regularly will help you get the most benefit from it. For best results, apply the cream after bathing or showering while the skin is still damp. And for very dry skin, your doctor may instruct you to soak the area before using the cream. Keep in mind that long, hot, or frequent bathing/washing can worsen dry skin. If your condition lasts or gets worse, or if you think you may have a serious medical problem, it's important to seek medical help right away. When using colloidal oatmeal cream, most people do not experience any side effects. However, some may experience burning, stinging, redness, or irritation. If any of these effects persist or worsen, it's important to contact your doctor or pharmacist. If your doctor has prescribed this medication to you, it means that the benefits outweigh the risk of side effects. It's important to note that many people using this medication do not experience serious side effects. However, if you notice any unusual changes in your skin, signs of skin infection, or symptoms of a serious allergic reaction such as rash, itching, swelling, severe dizziness, or trouble breathing, it's crucial to seek medical help right away. It's important to remember that this is not an exhaustive list of possible side effects. If you notice any other effects not listed above, it's best to contact your healthcare provider for guidance. Before using colloidal oatmeal cream, make sure to consult with your doctor or pharmacist if you have any allergies or skin cuts/infections/sores. Some ingredients in the cream may make you more sensitive to the sun, so it's important to check the label for any warnings and take special precautions when outdoors. If you have acne-prone skin, look for the word non-comedogenic on the label to avoid worsening acne. Additionally, some products may stain or discolor clothing. Before undergoing surgery or if you are pregnant or breastfeeding, it's important to inform your doctor about the use of this product. And if you are breastfeeding, consult with your doctor before using the cream, especially if applying it to the breast area. When using colloidal oatmeal cream, it's important to be aware of any potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It's best to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Before making any changes to your medication dosage, it's crucial to seek approval from your doctor. This will help ensure the safe and effective use of colloidal oatmeal cream alongside any other medications you may be taking. If someone accidentally swallows this medicine, it can be harmful. If they have serious symptoms such as passing out or trouble breathing, call 911 or the local poison control center right away. In the US, you can call 1-800-222-1222, and in Canada, you can call a provincial poison control center. Always keep this medicine out of the reach of children to prevent accidental ingestion. Remember to use this medication as directed by your doctor, and do not exceed the recommended dosage. If you have any concerns or questions about using this cream, consult with your healthcare provider. To help prevent dry skin, it's important to use lukewarm water when bathing, take baths or showers less often, keep baths or showers short, and use a humidifier when the air is very dry. When it comes to emollient products, there are various types available, including oils, creams, lotions, and sprays. Some may contain fragrance or other ingredients that could cause sensitivity in some people. It's best to consult with your doctor or pharmacist to determine which product may be most suitable for you. If you forget to use colloidal oatmeal cream on your regular schedule, just use it as soon as you remember. But don't use extra or use it more frequently than directed to make up for the missed dose. Make sure to check the storage information on the package, and if you have any questions, ask your pharmacist. Keep all medications out of reach of children and pets. Avoid storing the foam canister near high heat or an open flame, and do not puncture or burn the canister due to the pressure inside. Do not dispose of medications in the toilet or drain unless instructed. Properly discard the product when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.